a lot of the research is focusing on CBD helping migraines is looking at those endocannabinoid deficiencies in people. So I'm going to explain this again like we did once in another podcast. Your body makes its own cannabinoid levels. Over time, chronic stress, exposure to illness, trauma, our body's cannabinoid levels appear to decrease over time, okay? Some people at a more rapid rate than others. Why is that happening? Because there's an enzyme in the body that's destroying your body's own cannabinoids. When you take CBD oil, it blocks that enzyme from destroying your body's own cannabinoids, helping your body make more of its own. This restores that homeostasis or that balance to the endocannabinoid system. So that reference that I made earlier to the study where they were seeing decreased endocannabinoids in female migraine patients, you could see how that could potentially benefit them. Now, that's not the only benefit either. People who suffer from migraines may be familiar with a term called an aura. This is kind of like a warning sign for people before a migraine is going to hit. They might start to develop an extreme sensitivity to light, or perhaps their senses increase a lot. Smell, they become very sensitive to smell. Or they start to see little flickers of light in their eyes, or maybe their vision gets a little funky. This is called an aura. And that aura, one of the working theories is that it's related to a strong neurotransmitter release called glutamate, which I referenced earlier. It appears that CBD actually helps to block glutamate, which could potentially help to ease a lot of those symptoms. Now, we know too, with migraines, there's nausea. CBD has been shown to help with nausea, right? These individuals also tend to suffer from anxiety, depression, and insomnia. We've talked about it before in other podcasts, but CBD has been shown to help with those things, each of those, depression, anxiety, and sleep. So if we can get this individual sleeping better, if we can get this individual stressing less, if we can help them with the anxiety through CBD, could we potentially see less migraines? And some of the literature that we're seeing is saying, yes, CBD appears to be best used as a preventative treatment for migraines. So this isn't something that you would take just when you have a migraine. In fact, the research on that is kind of mixed if you're looking. And the doses that people are having to take to break a migraine once it hits is usually upwards of 400 milligrams. And that's typically involving some type of THC with it that they're seeing. But from a prevention standpoint, they're saying that dose between 10 to 100 milligrams a day, taken every day, appears to play a role in preventing that really, really bad migraine, that really bad attack. When we work with patients and we're helping them with taking the correct serving amount, in our case, the correct dosage, what we're explaining to them is if you see less severity of the headache, that's a great thing. If you see less nausea, we're on the right track. If your sleeping is improved, that's a great thing. If the duration of the headache, maybe they usually last you 4 days, this one only lasted a day. Those are all signs of progress and that we've set up that individual with the right serving size or the right amount for them. So that's one of the ways that we gauge it. We usually say, okay, let's start you at 10 to 30 milligrams a day, taken anywhere from 1 to 3 times a day. In the case of migraines, we usually recommend morning, afternoon, and evening in increments of 10 milligrams, and then we increase until we see the desired effect. In our cases, I don't have many people over 100 milligrams, but if you look at some of the studies out there, I think it was in India, I don't remember if it was in India or Europe, but they actually ran acute breakthroughs for migraines using CBD, and they were finding you needed dosages upwards of 400 milligrams, usually with an inhaled THC for it to be effective in actually breaking a migraine attack. One of the things that I do like to emphasize is your roll-on gel and the topical 500 milligram pain cream, that works. I get so much feedback from people, and of course we don't have clinical trials on that, but I get people who tell me they roll that onto their temples, right above their eyes, and then along the back of their neck, and they seem to do fantastic with it. Something will tell, they say it just helps to ease some of that pressure, right? And one of the things that we'll tell people too when it comes to dosing it orally that I wanted to mention, okay, so you do the roll-on first, and then we explain to people to put the oil, a few drops, right in the back of either side of your jaw. This is where your trigeminal nerve sits, especially for those migraine patients. So we find that to be more effective than just taking it under the tongue, especially for that breakthrough pain relief if they're trying to take that approach. But yeah, just a few little drops right here in the jaw to kind of dull that trigeminal nerve. We know that CBD oil taken orally acts similar to opioids without all the negative side effects. It turns down those pain sensors on the nerves. It turns down the volume on those. So I find that combination to work very well. Tension headaches, they do great with the roll-on, I would say. They do quite well with it.